I'm Dr. Mark Joffe, and I'd like to speak today about the PPE Safety Coach Program. About a year ago, the PPE Task Force launched the PPE Safety Coaches Program. This provincial program was set up as a peer-to-peer program aimed at increasing the proper selection and use of personal protective equipment in the frontline setting. Since launching this program, we've had more than 1,500 participants who have voluntarily signed up to be part of the program. On behalf of the PPE Task Force, I would like to thank everyone who has participated and been part of this program, and also the leaders who have supported them and for their commitment to this program. Our PPE safety coaches are making a difference. They're helping to keep our patients and our staff safe. This program started in part to help increase the proper selection and use of PPE in frontline settings during the early days of the COVID-19 pandemic. We wanted to prevent the spread of COVID-19 as well as other respiratory viruses such as influenza. The PPE Task Force recognized the need to develop a provincial PPE safety program. It looked to the success of some other programs in the province, such as at Alberta Children's Hospital in the Calgary zone with its Peer Safety Mentor program. That program was taken up by the North Zone, and it became the North Zone's officer program. The Alberta Children's Hospital program, as well as the North Zone programs, were used as the basis for the provincial PPE Safety Coach Program. This provincial program was meant to complement the pre-existing programs at local levels. But for areas without a program, we strongly recommend that you adopt the provincial PPE Safety Coach Program. This program again focuses on a peer-to-peer supportive approach. PPE safety coaches ideally should be available and accessible on every shift. They become the local experts in infection prevention and control and personal protective equipment issues. They can support the frontline staff using friendly, informal, and helpful approaches. To emphasize, this is not an auditing role. This is meant to be a supportive one, a role in which our safety coaches work collaboratively together with staff and physicians to make the workplace safer. AHS site leadership and unit management work with the staff and physicians to identify candidates to become safety coaches. Coaches then take some online training that has been developed by the AHS Infection Prevention and Control team and has been endorsed by Workplace Health and Safety. The training takes approximately 2 hours online. Once that training is completed, the safety coaches become available and hopefully accessible at the front lines so that they can support their colleagues. For example, in selecting appropriate PPE for the task, as well as guiding in appropriate and correct donning and doffing. The program hosts monthly community of practice forums. In these forums, coaches can come together from across the province to discuss issues and to learn from the experience of others. Leaders are encouraged to support safety coaches in attending these forums. Ideally, we would like there to be a safety coach available and accessible for every shift for all units and programs throughout the province. Our coaches have supported staff to become more knowledgeable, more skilled, and more confident in selecting and in using personal protective equipment, and for ensuring that appropriate processes for donning and doffing are always followed. The need for a point of care risk assessment and for appropriate selection and use of personal protective equipment will always be an important part of providing healthcare. An evaluation of our PPE Safety Coach Program is underway. We are going to learn from this evaluation, and we're going to look at how to optimize this program for the future to take us through this pandemic, but also well beyond, to allow us to keep patients and our staff and physicians safe. This pandemic has reminded us that there are risks to working in healthcare, and we need to work together to protect ourselves and to protect the patients for whom we provide care. The work of risk assessment and selecting appropriate PPE will never stop. So if you're interested, and if you haven't had a chance to sign up, please do so. If you are a leader, please take this opportunity to identify and encourage staff and physicians to become PPE safety coaches. You can find information about this program on the ahs.ca website. Your efforts and your ongoing support continue to make a real difference in the health and the well-being of Albertans and communities across the province. Your diligence is what allows us to provide the care that is needed while ensuring that we keep AHS staff and physicians safe.
Together, we do amazing things every day.